Hi, it's Sunday morning, and Alan and Andy are here to talk about healthcare issues. And today we're going to talk about the issue, since it's fall, Alan, we're going to talk about falls and also a new article that came out that discusses something that we who see a lot of elderly people see all the time. But go ahead. Why don't you get started?
So, Andy, I came across an article this week from JAMA. For people who don't know what JAMA is the Journal of the American Medical Association, which is one of the big members of the medical industrial complex, which supports physicians and hospitals and payment systems and everything else, and is a very wealthy organization that dictates a lot of what goes on in both clinical healthcare and medical education. If you read our book, and hopefully you do, Return to Healing, you'll see we have some not great things to say about the organization, but it's a mixed bag. But we certainly can't say they've been really out there supporting the growth of primary care. And we all know that primary care is the answer to our healthcare crisis in this nation. But the article is a viewpoint article. It's someone's opinion, but there's some really telling facts in there that really describe what's wrong with our dysfunctional healthcare system, especially the takeover by the pharma industry. So essentially, what the article says is that there is a significant increase in falls in this nation over the past 30 years. And that significant increase in falls is associated with a significant increase in prescribing over the last 30 years, where essentially every senior who had a fall was on at least one medication, and the vast majority of them were on like 2 to 9 medications. Okay. And many of those medicines that me and Andy have talked about in the book, like beta blockers and calcium channel blockers and diabetes drugs that treat a number, treating lowering blood pressure, treating lowering blood sugar, are being pushed too far. And it's being pushed to the point that seniors get lightheaded, they get dizzy, and they fall. And it's a really dangerous thing. And it's unexplainable. And the way it's unexplainable is that the fact that the rest of the industrialized world, the rest, has a decreased incidence of falls. And falls are now the number one cause of death in the senior citizen population, more than cancer, heart attacks, and multiple other things. So, Andy, we both see it all the time. I'd love to hear your perspective, but before I hand it over to you, I want to say I hope you're feeling better. Andy had, some recent medical experience in the healthcare system, and, he could take it, maybe talk about his personal experience of the risk of falls.
Well, my own experience is my own fault, Alan, because I decided to get a new knee because my old knee was not letting me run anymore. And people said, well, you could walk. I'm like, yeah, but I want to run. So right now I can't even walk. So we're 10 days later and it's a mess. And yeah, I was telling Alan that I got a cane and I was tripping over it. A walker where they put the wheels on the wrong way and I couldn't move it. So these are things that we in geriatrics are supposed to deal with because our patients are not supposed to be tripping over the devices to prevent them from falling. And that is also a problem. But yeah, I mean, I see a lot of falls in my practice. It is the number one problem that I see, and it's almost always caused by something with medicine as an add-on. So you mentioned a lot of blood pressure and diabetes medicines. We cannot forget the statins, the cholesterol medicines that cause massive, and we wrote an article about this, Alan. I mean, massive muscle weakness in the elderly. And the cardiologist will tell you, well, that's just all internet fantasy. Well, I've seen people get strokes or put on these massive doses of statins, are they're getting better from the stroke, and then now they can't walk. And sometimes the muscle destruction is permanent. And on top of that, you mentioned the death rate. Now we got all these people on blood thinners. And again, the cardiologist could care less if they're fall risk. There was a study done out of Europe because all the studies about outcome that show anything bad about medicines are in Europe, where they actually care because they pay for universal health care. So they actually don't see, for us, when people fall, it's more money for the medical industrial complex. More people get involved, more doctors, more procedures there that it hurts them. So this study looked at elders who were considered frail. And the number one definition of frailty is they have a high risk of falling. And a lot of people go on these blood thinners to prevent strokes. And we know, and we talk about it, the numbers in the book, that they prevent about a 0.5% of noticeable strokes a year. Well, the people who are on the blood thinners who had a risk of falling, uh, almost 2% of them either developed bleeds in their brain or died from bleeding in the first year. And 15% of them uh, had such serious bleeding that they had to go to the hospital per year. So you add this stuff now to all the other medicines that people are using to fix numbers that make people fall. Let's get the cholesterol lower. Let's get the blood pressure low. Let's get the sugar lower. Oh, they fell. Let's send them to another doctor. And if they bleed in their head, that's again a bonanza for the healthcare system. So strokes, actually, Alan, since we've been doing this, have gone up in number. That's another article that came out recently. We're the only country that has an increase in strokes, and most of them are bleeds in the brain. We also saw recently an article that came out this last week that showed that we have the worst outcomes in terms of chronic disease death in the industrial world. We're worse than a lot of third world countries. And everyone else is going down, and we're going up as we add more medicines. So, yeah, it falls as one example, a big example of how our medicine epidemic is number fixing epidemic is causing actual harm, not help.
Exactly. So, you hit the nail on the head with the chronic disease. So, we treat our problems in this nation with drugs, and the rest of the world actually talks about lifestyle medicine because there's a payment back for doing it. People don't fall, people are stronger, have less weight. So our problem in a country, comes back to the obesity epidemic, and let's give people drugs. And the obesity, contributes to the high cholesterol and the high blood sugar and the high blood pressure. And let's continue to treat those numbers, 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 and two drugs for this one and three drugs for that one and four, because the cardiologist says we got to get your blood pressure to this number, and the endocrinologist says we got to get your blood sugar to this number, and the lipids and all of that. And we forget the fact of what we're doing to people rather than for them. And the rest of the world looks at, okay, how do we prevent disease with lifestyle medicine, healthy eating, and exercise? And those two things contribute to wellness and health and decrease falls. And I want to add, I see it all the time. Unfortunately, I have a patient in the hospital now who had a bleed in his head. He fell. Family doesn't know why he fell. It was an unwitnessed fall. They were in the home. They heard a big thump. He was in his late 70s. He was not on an anticoagulant medicine. And, unfortunately, this is a guy who's got, metastatic cancer in him and multiple medical problems, and he was frail and, probably didn't get the rehab that he needed. I was pushing for that after his last surgical procedure. And, you got to push people to do things that, we want the easy way out. Give me another pill to kind of make it better is the easy way to do this in this country. And the evidence is clear. The rest of the world is improving in longevity, and we're declining, and it's for these multiple reasons. The chronic illness is a result of our lifestyle, and it's worsened by all the drugs we throw at them.
We create new chronic illnesses from the drugs. It's like what Osler said, if you have a problem and add a medicine, now you have two problems. And I know we in our book talk about a big study done at the Lown Institute. And again, Lown's a think tank in Boston, and Alan and I were very involved with them for a long time. We met there. But this study it was called the Real Drug Epidemic in our country. And it's basically saying, and we've seen a lot there's a woman named Dr. Starling who talks about this all the time in the geriatrics community. If you're over five drugs, each sequential drug increases your risk of poor outcome. You're actually going to do worse. Even though your numbers look better, you're going to do worse. And that is the great paradox of our healthcare system. We have people probably across the world, our numbers are probably better than any other country, but our health is substantially worse. And that until we see that discordance between number fixing and health, we're going to keep going down this road because everyone seems to think, oh, my sugar's good, my cholesterol's good, my blood pressure's good, got all these numbers down, my bone density is good, but then they fall, they break, they bleed. Alan, another just to show the insanity of our system. I talk about this in my practice newsletter. Cardiologists are now in mass, and the American College of Cardiology may or may not be involved, sending free atrial fibrillation monitors to people's homes. And the point of that is to detect more minuscule atrial fibrillation. It may not even be real. It might be a 1 minute out of the year, and then put them on these blood thinners, or send them for a Watchman procedure, which itself is very lethal. It's trying to tell people they're sick and they need more medicine. It's almost like the system is doing everything it can. And you mentioned the obesity epidemic, and how are we addressing that now? What does Oprah say we should do? Take drugs for this.
Well,
Not eat well, not exercise, just take some more drugs. So it is a drug society. That's what we're living in, and that's causing our problems. We just got to somehow see and you and I deal with this in our practices. And I always call myself the medical medicine eraser. People come in with 15 drugs and they get down to five after they're done with me for a few months.
no.
But that's the way we do it. We're good in our micro environments in trying to fix the problem. In the bigger scheme, it's really hard.
And we're not going to be able to do anything because the food industry contributes to it. I don't watch much TV, but when it's on, you can't not see an ad for Wendy's or Popeyes or all of these places. It's either that or for drugs.
Yeah,
So
that's number
like,
one and number two,
yeah.
actually.
So
And food is one
I
and
didn't
drugs
know
are
that.
two.
So
Yeah.
thank you. But that's all you
Yeah.
see. But we're just continue to contribute it. My biggest example, the one that kills me, is the families that decide, and I have never sent a type 2 diabetic. Type 2 is the kind from what we eat, not from a lack of insulin that young people get. Type 1 diabetes needs insulin. It's the only way you could treat it. You can't treat it with the other drugs we have, unless they're obese as well. And it's amazing. I say, this is okay. The hemoglobin A1C is 8. It's okay. You're 80 years old. I almost kind of say, if you're 70, 70 is good. If you're 80s, 80 is good. 8 is good. And they end up going to another doctor. They end up coming back. They're on like 3 oral drugs, including the family, the drug glipizide, which causes prolonged hypoglycemia. And they can't fix it with 3 oral drugs. Then they add insulin. And when I see an elderly patient on insulin, I say someone is trying to kill them
Yeah.
because, the hypoglycemia that's associated with it, elderly folks can't feel getting hypoglycemia enough. They take a high dose of a long-acting insulin at night and they don't wake up in the middle of the night and they get hypoglycemic and they get up from their bed and they fall. And that's exactly what this article is saying. So like the specialists are doing it. I teach the residents all the time. I would never put a type 2 diabetic on insulin. It is only going to make them fatter and worse. It is the only thing it's going to do to them.
It doesn't increase longevity. It's been shown over and over again not to. And not only are they doing that, Alan, they're putting people on what we call insulin. It's insulin with meals. So they're putting them on, they check their sugar. Now that we can check sugar constantly, we got more numbers to work on. And they're taking these 3 time a day short-acting insulin and then a long-acting insulin. These old, frail people. Some of them have dementia. And it's just all for number fixing. And it's been shown to be a tremendous cause of falls and also worsening dementia, more fatigue. Everything you don't want when you get older is caused by insulin. And yet yeah, the endocrinologists who are so obsessed with their numbers, that they're number doctors, that's all they do. It is causing this problem. And we
Yeah,
take we take them all.
and I chuckle to myself when I get that, especially like you brought up the patient with dementia. I said, do you realize dementia is a life-limiting illness? You're not just forgetful. Like you don't know how to navigate, walking through the home. And they're at very, very high risk of fall, the people with dementias, because they're not hearing as well, they're not seeing as well, they're not thinking as well. And now you're lowering their blood sugar and they go boom. And it's the start of what is, well known in medicine. I hate to say it this way. It's called the death spiral. The death spiral is, you fall, and even if you don't break something, you end up in the hospital. And you're in the hospital and you become more demented because you become disoriented and delirious in the hospital. That was my bird. And then you need to tie them up. They tie them up. Why do they tie them up? Because if they fall out of bed, it's another ding against the hospital if someone falls in the hospital and gets hurt. So they either have to put them on one-to-one, which is someone sitting there watching them for 24 hours, which most hospitals can't afford anymore. So you put restraints on people. And then they aspirate, they eat something, the food goes down the wrong way, then they get pneumonia, then they get septic, then they get a urinary tract infection, septic being an infection. And the falls, lead to a surgical procedure, which leads to sepsis, and we've now killed another person. And that's just the truth. And people don't want to hear that truth, but that is the truth.
I've had exactly those scenarios happen more than I could tell you. And too often the families of these people say, well, thank God they were in the hospital because look how sick they were. And they don't realize that it was caused by these overaggressive specialists and then a hospital that ties people down and then force feeds them despite this. And then, by the way, when they force feed them, they just give them more insulin. Now they're on 3 times a day insulin. It to us, it's like it's criminal that
It
what's going
is.
on. To our medical system, it's the norm, and that's the problem. So,
It,
and in my world, like I said, you don't have this problem. We're not allowed in the hospitals. We're
yeah,
not
so
allowed to consult. So,
Andy, it is criminal. I think it's criminal, and it's criminal with the insurance company. So I started earlier about telling you about the patient I have in the hospital that had a fall and a bleed in his head. That causes a stroke, essentially. And his deficits are relatively not that bad. He has some trouble getting the words out, and he's got about like 60% of his strength. This is a perfect candidate for inpatient rehab. Like if he got aggressive rehab for 3 or 4 hours a day, he would likely have a normal functional life. The insurance company refuses to pay for it, so they end up going to some subpar, crappy nursing home that does like, 30 minutes of sit in this chair and move your legs every day. And we know the rehab nursing home system in our country is a total failure. That should be, one on our list as well.
yeah, absolutely. And we both work in those situations too. And it's really a shame because there is a right, there's never one right answer, but there is a better answer. And we know what it is, and our system actually gets paid more to do the wrong thing. People are paid more, people are and unfortunately our media just feeds into it. Because again, number one and two, food industry and drugs are there is what pays our media. So and they actually complement each other
Yeah.
very nicely. I saw that there's still ads for Cheerios that lower cholesterol, and it was Honey Nut Cheerios, for God's sake. So yeah, I mean they all pretend to be drugs, even the foods.
Yeah.
Like Twinkies are probably from, but Coke now says we're healthy because we have real cane sugar.
Yeah.
So
Nice.
that's the way it is.
So you're right, Andy. We get paid to do things to people rather than for them to help them, like counsel them on diet and nutrition. I want to ask you a question. I'm putting you on the spot because and I'm going to admit my biggest problem with prescribing meds to the elderly is those little old ladies that come in on Xanax and Klonopin and Valium, and they've been on it for 30 years, and you tell them I'm going to wean you off, and you're about to get punched in the face by an 85-year-old woman who says what? So tell me how you handle that one. That's my biggest struggle.
Honestly, Alan, I keep them on the drug
So
because
do I.
at
Okay.
this point that they're completely it's not even affecting them. It's like normal now. They've increased their receptors. They probably it's like they're not on the drug at this point, and they think it's helping them. So I think when you have a chronic drug like that, it's not going to cause the same problem. Especially with these mental drugs. So I think I'm more concerned with the other drugs that they're on, and I always use that as a bargaining tool. Sure, we'll keep you on that, but let's talk about this statin you're on. Do we really care about your cholesterol at age 90? So and I got to tell you, my patients are very amenable to coming off drugs. So it's not, they're more afraid of offending the specialist, which is really funny.
Well, they're amenable to coming off the drugs, but then you hear about when they went back to the specialist, they said your doctor doesn't know nothing. Like
Well,
the
that's what
spe
they
the
say. Yeah.
specialists have no problem dissing us.
Oh,
You
they
know,
love, that's why we're dissing them right now, right?
Yeah. Well, honestly, I don't diss them in the office setting, one-on-one with the patient. I kind of
No.
explain that there's different ways of doing things. And I explain that, the cardiologist is treating the blood pressure and the heart rate, and the endocrinologist is treating your sugar and the statins. I tell them that. And I said, numbers are not making us better in this country. The numbers are killing us. And this article really says it's a short little article, but it really says how we're killing people in this nation by treating them
Yeah,
rather
and that
than
and that is
good
what we
diet,
do.
exercise, physical therapy.
That's what you need. And you need a doctor who cares about you as a whole person and could see the nuance of saying, yeah, your blood pressure might be better, lower, but you're gonna other things are gonna get worse. So we're not gonna do that. So you need someone who's willing to look at you as a whole, and that's what primary care is about. So any last words, Alan?
No, I think you hit the nail on the head. We need a system based on primary care, and we need to reward doctors to doing things to help people, not doing things to people. And it's not about being on 15 drugs and having every number perfect so someone could fall and break their hip and end up dead.
Yeah, it's about being on fewer drugs, taking care of yourself, not worrying about your numbers so much, worrying about how you feel, and trying to make yourself feel better through your own initiative. And that's what we're there to help for. Okay,
Exactly.
Alan. So
Yeah, feel better, Andy. I hope you
thank
get
you. I'll see you
moving
next week.
soon.
Okay.
Take care.
Take care.